system is sort of still very, very rich in pilots, but thin on sustainability, which is the gap that, the Nigeria Digital in Health um, initiative is trying to see if we can quickly close. And then the question then to everyone that I'm going to then throw to everyone is, are we then really ready to move from those isolated pilots to national programs and support government as we hope to improve service delivery for the betterment of the people? Over.
Thank you so much, Dr. Leke. I think you've actually entered the next thing I had wanted to talk about, which is you've mentioned we are at the point where we are still dealing with a lot of side projects. But what would it really take for us to break this cycle? And not just from the angle of the government, right? The government, we, the innovators on the call, we that are trying to support, implement. What would it really take to break the cycle where everybody is doing their own thing, and that doesn't really help with sustainability and scale?
So I know you said aside the government. Thank you very much, Victory, for that question. But then I think the first thing really is government. And from a policy standpoint, you can't get anything sustained without policy. You know, every new, there has to be policy enforcement. So every new digital investment, private, public, it must align with the national priorities. There is no other way to paint that. It just must align with the national priorities. So that's first thing. I think the second thing for me is interoperability, right? We must ensure that, our systems can talk to each other, through like following again national standards. The reason why we sort of can, the way I sort of explain standard is the reason why we can understand each other on this call today is because we communicate in the same language, right? And so that's sort of the standards that needs to be followed as far as data exchange and interoperability is concerned. The third item I'm going to quickly just pick on very quickly is coordination. And with that, I'm going to just talk briefly also on public-private partnership. It is important that private sector come in, the donors, private innovators, we must work within the same framework, not in parallel lanes. Like I said, ACE cannot continue to go its way while HSDF, Victory is going our own way, Leke is doing his own thing. It's time we all came together and sort of collaborate. So the government cannot do it alone. So private sector is very key and instrumental to achieving this as well. Thank you.
Thank you so much, Dr. Leke. So, and I had tried to exclude the government, but you brought the government back. And I think that that's very interesting because it's the same thing with every other sector, right? It's not just the health sector or digital health. The government has to be the one to lay the framework and the architecture that everybody else can build on. And so I think that now brings me to the next part. We have it. I know we have a lot of innovators on the call, and I know a lot of people want to know: is there a system, or is there something on which we can build on to allow better interoperability? So I want to ask, I know that when I did some research around the topic, and when I was going to be speaking with you, I learned more about Nigeria National Digital Health Architecture and the fact that the architecture is being built to kind of unify digital health innovation and to help us move towards a less fragmented system. I want to know, maybe you could tell us more about the National Digital Health Architecture. That's first. And then also, where are we at in developing that architecture?
Okay. So thank you very much again, Victory. You're hitting on some very, very good points that we really just want the public to be aware of. So NDHA, the Nigeria Digital Health Architecture, it's not just a document. I think if you go on our website, I told the team to put it on the website. I think it should be there. Was that where you got it from?
Yes, yes, I
Okay,
did.
beautiful. Yeah. So it is there on the website. So it's not just a document. It is sort of the Nigeria's, call it a blueprint, or sort of the foundation for the potential unified, integrated, and secure digital health exchange system. It's pretty much a set of standards, governance structure, interoperability framework that sort of speaks to how we intend to connect, data from MPSCDA, NHIA, our federal government itself, national, at the subnational level, the state data, private sector data, to sort of see how we can put it together. So, well, to speak more about it, uh, the idea was formally endorsed by the National Health Council. I believe it was last year, and then in June of this year, we came together in Abuja. The National Nigeria Health Commissioners endorsed it with the Honorable Commissioner. With the Honorable Minister of Health. Um, to say that this is the direction we're going. So it's a document that has a schema in it, I believe is on page 11, that sort of speaks to some building blocks, trying to use the NIN as a unique identifier for the client registry. We're going to also build a facility registry. We're going to also build the healthcare worker registry, because you need to properly identify the patient you're treating. We also need to know the provider that is treating that patient. I want to know where they're being treated, in an attempt to also then build the patient shared record. So that way everyone can finally take ownership of their own healthcare data. So what else should I say about the NDHA? It's quite a huge document. I think it's about 40, 30 something pages. So I encourage everyone, it's a small read. I encourage everyone to read it. So the essence of it, I think in a nutshell, is a document that speaks to how we want to bring all the stakeholders together as far as health data is concerned. Where are we? The OAK project, as some, maybe not all on this call, is aware, together with the Federal Ministry of Health and the SWAP Coordination Office, is sort of taking the lead on these. And we are at a phase where we are seeking, in a little bit, we're going to be seeking vendors, in actual fact, to build these architecture. We're writing some TORs of what we want those vendors to, the sort of skill set that we want these guys or these vendors to possess. So that's the phase that we are right now. And I hope that in the next couple of months, when I come back to ACE, and or when I'm invited next on this webinar, I can tell you for a fact that the building of some of these building blocks is already started and is ongoing. Thank you.
Okay, thank you. I like the part that you said when you're invited back to it, because we will be
I saw the
invited
I
back.
saw the smile on your face when I said that. Thank you.
Because you'll be invited back because I have follow-ups.
Yeah, it'd be
And I
nice
think
to
my follow
come back and give updates. I think
yeah,
Nigeria needs to move away from, making promises and not being accountable. So, we on our own hand as government sort of want the public to also hold us accountable. Because if no one is holding you accountable, you're probably not going to do anything.
yeah.
So please, everyone on this call, hold us accountable, mark my words, and pray for us also that we deliver on what we've promised. Thank you.
Thank you so much, Dr. Deke. I think my the next thing I want to bring up is kind of leaning into what you've just said. I want to know, for an innovator that's trying to build something right now, let's say an EMR or a reminder tool, is there a way we can, or me too, can start thinking about the interoperability from the architectural lens, so that we are not phased out by the time our architecture is fully developed. We are able to easily plug in. I
I
don't know
think
if
the
you
first
understand.
thing, no, 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 very, very clear. I think what you're asking is, how do folks like you and I on this call, like youths, young people, young minds, brilliant people, innovators, how do they position? Because right. So that way,
Yes,
whenever the exchange, the architecture is built, and then they can leverage on that and then build third-party applications, right? Is that the question you're
yes,
asking?
yes,
Okay,
yes.
beautiful. Yeah, so I think the first thing is for everyone to go ahead and read that document. All right. Call us out on that document. There's a feedback form as well that I put on there. So that way folks can tell us, we don't know everything. We're hoping that, folks on this call today can read that document and tell us, hey, I think the way we are going is not going to be the best way. Of course, don't be rude. If you're rude and nasty, I'm not going to respond to you. I don't care what you're trying to present. All right. Just be polite, be an individual, and let's just treat each other well. Because I know the younger people these days can be slightly a little harsh. I mean, some of them, right? So don't be rude. Just come off as we'll listen to everyone, right? So the first thing is read the document, the NDHA document, understand what it is all about. If you have questions, please feel free to ask. If you want to provide a feedback or reaction, kindly use the feedback form that is also on the website. On my end, I'm going to double check after this call to make sure that the feedback form is there as well. So let's hear you. The second thing is the standards. So in a little bit, in a couple weeks, actually, we will be finalizing the standards document that everyone is then sort of the standard document is going to be the language for the architecture in order for you to be able to plug in. So I think the innovators and the tech guys around us on this call, I'm sure they already understand what I'm talking about. So I think with those two things, and sort of like thinking futuristically, I think would be the third advice and the last I'll give on that. Like thinking futuristically, right? Like pick a problem. All right, there are too many problems in Nigeria. There are many problems in Africa. Pick a problem, all right, and just try as much as possible to solve it. You know, there's a book I was just going to recommend to read, a new reader that I'm reading, but I'm not sure. It has nothing to do with digital health. Just talks about picking a problem and then following through and seeing how you can sort of provide a solution to it. But let me leave that. Over, Victory, over to you.
I was going to say, please don't leave it. Please suggest the book. Please don't leave it.
I will text you after this. Maybe the leadership of your
Okay.
organization can sort of prove it and make sure that it's something that you want to put out there for folks to read. So I'll
Okay.
text you after this. Yeah, thank you.
All right. Thank you very much. So thank you for that answer. We will try to follow up with everything that is going on so that we know how to plug in rather than just working individually, coming up with an idea, developing something, and then you now realize that it cannot really scale past the little place you tested it in. So Dr. Leke, I know that when I'm reading up on your profile, you are very well exposed. You've seen other systems. You've at the moment I'm sure you are like facing with a lot of people from around the globe. So I want to know, are there lessons from other countries' digital health journeys that Nigerians and Nigeria can adapt still looking at our context? I'm saying this because Nigeria is a little bit late in the digital health transformation. There are countries that have gone way, way far, and we are trying to catch up, but we are still faced with a lot of our own peculiar problems like funding challenges and the problems with the structure. So are there lessons that we can learn, even if they're from neighboring countries, or
Yeah.
Western countries? Yeah.
Sure, there are definitely lessons we can learn, but let me first, maybe just, I don't want to say correct, but maybe suggest something. I think every country is suffering from financial problems. All right. I'm in America right now. They have financial problems. The UK, Canada, everywhere, they have financial problems. So Nigeria, as far as I'm concerned, we're doing well. We can do better, but then I understand there are challenges as far as infrastructure, light, connectivity, network, and things like that. But there are things that, over time, with the current administration, with the renewed up agenda, I feel like we're going to be at a better place in a couple of years, and I say that very, very confidently. Not as a politician, I'm not a politician. I'm a technocrat, and I'm also a reader. I like to read, and I like to understand what is going on. And I feel like Nigeria right now, I think we're starting to do good, at least from where we were in the past decade or so. Now, lessons to learn. Um, I'm a very strong believer of not reinventing the wheel. A few countries where we were, as far as digital in health is concerned, and so like taking lessons from them, I think is critical. Like Rwanda, Rwanda has done some amazing work with their AI-driven supply chain. It's something folks on this call can go ahead and read about as well. They've done some good work. India, they demonstrate how technology can sort of transform maternal health and also TB detection at scale. I was just in Tanzania like a little while ago. They use something called the SBBC, that drives maternal and child mortality rate down. Um, Estonia has done some very good work as well, even though all of these countries are tiny little countries except India, but they have like use cases that I think are relevant to Nigeria as well. So I believe strongly that Nigeria can learn from these examples. And like I said, I just came back from Tanzania on a study tour in a very rural setting. It's called Haydon. I don't know if anyone has been there, you know. So trying to learn from these countries and not reinventing the wheel. And also whatever solutions, whatever ideas we're bringing back home to Nigeria, well, like you mentioned, trying to contextualize it or fit it into our own uh, peculiar context in Nigeria. So yes, lots of lessons to learn. We're learning from it, and we hope that folks can read about other countries and tell us what you think are solutions as well. But don't come and tell me that America has the best as far as interoperability is concerned, because they do not. Up to date, Sana and Epic and NextGen and Centricity, all the electronic record system do not talk to each other. Because whenever Obama passed the ITEC in 2009, for the meaningful use one, it was just like, okay, everyone go ahead and deploy, right? Or adopt electronic health record systems or medical record at that point in your facility, not thinking that at some point there would be a need for interoperability. So we hope that we're going to do better, than the US. As the fintech in Nigeria, in my opinion, is doing a lot better. If you transfer money from Zenith to MoneyPoint, you hear that pool sound in like 1 second or less than a second. It's not the same for Chase and Bank of America. It's not just the same for Wells Fargo and TD Bank. So I hope that as we leapfrog in Nigeria and we try to move fast and close the gap and the margin and the digital divide, I hope that we'll continue to get the support of everyone, and I hope that other countries in a decade or so, like the US, will come back and learn from us. Over. Thank you.
Thank you so much, Dr. Eke. So I think one of the things with coming in late to the game is that you can learn from other people. You can learn from their mistakes. You can learn from their successes, and you can easily leapfrog, as you said. So I think that's what happens with our fintech structure. And actually, I'm a very strong believer in the fact that if we study the fintech and how we were able to do better, we can easily do better with our digital health ecosystem as well. Before I ask the last question from my end, before we incorporate everybody else's question, I want to so everyone should put in their questions, their comments, their insights in the Q&A box or in the chat box. We are going to be taking that shortly. So, Dr. Lekem, the last thing I want to ask from my end is, if you fast forward 5 to 10 years from now, let's say 10 years from now, 2020, what does that look like on the information? What does it look like? What are we aiming to achieve? What's something that we're working towards, so that everybody has, this and make the vision clear. Everybody knows the vision that we are running towards. Yeah.
Victory, I think I lost you for a minute. I think you said if I fast forward 5 to 10 years, let's say 10 years, what
Yes.
what was the question?
What do you envision? Can you hear me now, though?
Yes, yeah, very clear now.
Okay. What do you envision that Nigeria's digital health system would look like? What does our digital health transformation look like? I'm saying this because there's a saying that we should make the vision plain, so he who sees it will run with it. So, what is that vision that we are supposed to be running towards?
Beautiful. So in the next 10 years, I envision in Nigeria where like every patient their health data is securely accessible across like different facilities and levels of care. Moving from the community level to primary health care centers to secondary and tertiary facilities, right? And as they cross geopolitical lines as well, I'm hoping that every patient healthcare data is accessible. So that's the first thing. I also envision a system where the amazing and the very hardworking healthcare workers use integrated platforms, not multiple portals, not parallel systems, right? So one of my other hope, at least, or vision for the next 10 years is that we quickly ramp up and folks are trained like the health workers as far as digital literacy. We close the margin as much as we can. I envision that in the next 10 years, um, our digital health ecosystem will be sustainable. It will be government owned. Yes, that's the word I was looking for. It will be government owned. and particularly inclusive, with private sector, with all the stakeholders being carried along as we go. And lastly, I hope that not even in the next 10 years, I'm thinking in the next 5 years, maybe less, we can actually start turning this data that we're gathering into information, for meaningful decision making, right? Because what's the essence of collecting data if that data is not going to translate to information for decision support and decision making at a very high level? So these are sort of some of the things that I envision for the next decade or so. Victory, please check your time. I may have to run. I texted Hafiz over.
Oh, okay. That's okay. Thank you so much. I had wanted to summarize, but I'm just going to jump quickly to see if there are any audience questions. Nimi, could you help us take the audience questions, maybe one or two before Dr. Leke has to leave immediately?
All right, thank you very much, Dr. Vitri, and thank you also, Dr. Leke. Very, very rich conversations, actually. Because of time, we have just one person on the call whose hands are raised, but then we urge everyone to please put your questions in the Q&A box if you have any questions or contributions or comments. It was also worthy of note that we've also put the document, Dr. Leke, the document you had mentioned, which is the NDHA. We put that document on the chat box for everyone to go look at it, read, and stay informed. So Ndoma got sent. Please go ahead.
While you're there, Samson, please go ahead and put the link to the feedback form. Go ahead and throw that on the chat board as well.
Fantastic. We'll do that.
I hope I didn't mess up your name. Please go ahead with your question.
All right, thank you so much, Dr. Leke. I've been following the amazing work Nigeria is doing in the digital health space. I listened extensively to Dr. Lassa when he was State Minister for Health, and also I listened to you at the Africa Digital Health Summit that was last year when you spoke about the digital health infrastructure in the country and how things are. And I've also been privy to read this document, the ADHI document. I think in page 10, that document showed the architecture for digital health interoperability in the country. And of course, you have said something very, very important about not reinventing the wheel, right? Building infrastructures that are connected together. And I wanted to say that Dr. Victor also said a lot of things that were very important, especially as it relates to fundings. One of the major issues that we have in the health tech space as it relates to scaling bold and innovative ideas is really, really about funding. I'm going to cite an example. When was building a clinical support system that would be used alongside clinicians, especially because, in Nigeria, we are currently faced with the problem of brain drain. And most of our teaching hospitals in Nigeria are even manned by house officers, junior resident doctors, right? And they are even overworked, as we have seen with the incidents unfolding a couple of months ago, right? With medical doctors even dying out of fatigue and overload. And so this clinical support system was supposed to be used by junior doctors and house officers to facilitate clinical decision making. And of course, the AI system was built using the hospital protocol, means using data from the hospital, generated from the hospital, right? Which means that if consultants have managed situations 3 months ago, house officers should be able to look at those records and also manage similar cases. But this project did not receive any attention, right? I had several conversations with him and he was telling me how frustrated he was. Excitingly, he left to the US 2 months ago. And as at last week, he got the funding for $2.6 million, right? For the same project the young man has been working all around in Nigeria here. Yes, I understand that in Nigeria and all around the world, there is limitation of fundings to support very bold ideas. But I think that as a country, Nigeria, right, we can do much a lot better. 80% of the fundings, and when I say 80%, I'm being patriotic, of the fundings we have to scale our innovations are outsourced outside the country. Generated, right? And us for Zion Tech Hub, my name is Godsent Ndoma, and for us as Zion Tech Hub, we built an AMR system that is completely wired with artificial intelligence, and of course using data generated from hospitals, of course, because we wanted to follow the hospital protocols to actually support clinicians to make decisions, right? But most importantly, we actually were trying to solve the problem of interoperability. So we built something called the biometric health card. is being linked with electronic medical
Wait, you built
records.
something called what? I didn't hear what you said. You said you
We
built
built,
something for
yes, we built
interoperability?
a patient biometric health card. That patient biometric health card is connected with electronic medical record, which means
Okay.
that I'm speaking to you right now, we have over 2 these cards in circulation. We even wrote a letter to your office. I'm hoping to see you, Dr. Kudera.
You're hoping to see who?
Yeah, we wrote a letter to your office, hoping to see you, but we were told that you were not in the country. So we are hoping that possibly when you're back to Nigeria, that we could show you this biometric health card that we have built, centered on solving the problem of interoperability. So what that means is that if a patient in Abuja, for example, travels from Abuja to Lagos, with that patient biometric health card, the patient is able to access their records. So there's a QR code at the back of the patient. Once that QR code is scanned, the handheld device, more like the phone, clinicians, wherever they are able to see that record of that patient and able to continue care. So we believe that like Nigeria, where we have
Thank you, Idoma. We're struggling to hear you, but we just hold on a moment for Dr. Leku to just respond to your question on the funding challenges because we have other questions as well because of time.
Yeah, and I'm not sure how many more I can take. Idora, how do you spell your name? Is it Idora?
Ndoma.
Indoma. Okay, good. So first thing first, I'm not sure where the letter that you wrote, like where you went to and who told you that, but please, ACE is going to connect us. And so let's have a chat, outside of here, regarding the interoperability piece that you were talking about. As far as funding is concerned, I do not have an answer. I think I mentioned it earlier that, every country has funding problems. Nigeria can only give what Nigeria has. Yes, can we prioritize innovation and prioritize health, a bit more? 100%. And I think that's what this current administration is really just trying to do. Is there room for improvement? Yes. Are they doing their best? I believe so. So let's all continue to be supportive, and we hope things are really going to get better. I'm happy for your friend that got $2.7 million in seed funding, right? Congratulations to them. It'd be nice to have a chat with them at some point as well. So you, after we've connected, maybe you can do the connection to them as well. I do not think I missed any more of your questions. I think it was more so telling me the amazing work that your organization is doing. So maybe I should try to take one more question before I go. I'm just about to get into the UN building now.
Yeah, thank you so much, Dr. Leke, for that. And we'll just take one question that we have on the chat box. And then for any other person that has questions, please feel free to put it up. We're going to collect the questions, have him respond, and then we'll share that on our newsletters, which you can subscribe to. So this question is, and I'll just quickly take it. What is the government's view on privacy, given past history of leaks of sensitive info or maybe residence data, such as the NIN, especially as it's a sensitive information that will be shared with the process being envisioned in the document? I'm pretty sure it's referring to the NDHI document. Over to you, Dr. Leke.
Yeah, so we're taking security, privacy very, very, very seriously. As far as I'm concerned, if I ask the folks on this call, I wish we can quickly do a poll. Which one is more important, your financial data or your health data? Most people are going to say their financial data because everyone likes money, right? Especially, what's the name of this brother that I just spoke? I'm just kidding. But I think the most important for me, and I kind of want us to start saying it that way, is your healthcare data. And for the Ministry of Health, for NDHI, that's how we're thinking about it, because your health data is very, very crucial. We're taking cybersecurity, we're taking privacy very, very seriously. We actually have a whole committee, of the 20 implementation committee. We have a few guys that are their only work is just to make sure that security and privacy is robust enough, and we do not have any problems of leakages. Now, to speak to NIMSI, whatever the leakage that was said about the NIN, now leakages happen everywhere in the world. There was something that happened in England a couple of months ago. I was hoping that would be the example that would be cited, right? But the NIN leakage, I have friends that work there. I spoke to the DG myself about some of the leakage. Not every one of those things is true. Nigerians, some of the time we like to badmouth, our own country and just see everything negative about the country. And I understand because folks from everyone's vantage point, you have to sort of speak from there, right? But it's not as bad as people paint it. Your data, your healthcare data is going to be super secured. And NDHI is doing everything, and government is doing everything to make sure that data is protected. The Nigeria Data Protection Commission, we're following all their guidelines to make sure that we secure everyone's data appropriately. Thank you.
Thank you so much, Dr. Leke. Please, can we just have one more person? Anthony, could you quickly say your question? Very short, very simple, please.
Yeah, good day. Can you hear me? Hello, can you hear me?
We
Yes,
can
we
hear
can
you.
hear you. Please go ahead.
Yeah, thank you very much for the opportunity. My name is Anthony Anyang. I'm an eye doctor. I'm also in the data and AI space. Thank you very much, Dr. Leke, for the input so far. So my question is, I'm an innovator. I'm in the eye care space. So I'm looking forward to innovate technologies for eye care, right? But my concern is this. You know, like I said, I'm an optometrist. How do you think I can navigate building technologies, eye care technologies that solve a problem without spoiling business for my colleagues? You know, for instance, building.
So I think your question is very clear, and I think
Yeah.
you also have the answer to the question. All right, is first identifying a problem. All right, a problem that you can then identify a solution that you can take to scale. Right, identify a very specific problem, that you want to solve. I think that book that I spoke about earlier, once the leadership of Hayes Strategy approve of you guys reading that book, I think you should read that book. It would help you to identify, because there has to also already be a pending a problem in your mind that is sort of firing you up, right? Like, so identify that problem just one at a time, and then go for gold. And your friends, I'm sorry, I don't know, but once you go to scale, I'm sure there will be benefits to them as well, as you identify and provide solutions to the problem. All right, I'm not sure I answered your question correctly, but my mind is super divided right now. That's the UN building. My boss, the Minister of Health, is waiting for me. So if I'm gonna keep my job, I'm gonna have to go, guys. Thank you very much.
No problem. Thank you so much, Dr. Leke. Thank you so much. Honestly, thank you for the rich conversation. I thank you for the insight that you shared. I think it's very clear that we have a shared problem, and we also see a shared opportunity that we can leverage on. The fact that the government is doing a lot of work also in this space actually makes me quite excited. I learned a lot, actually. And I think we should look at the document. It's on the chat box if you haven't seen it. For those that have their questions on the chat box, please do not be worried. We are going to collect all your responses, all your questions, and then we'll collect the responses and share via our newsletter. So please subscribe to the ACE newsletter. You can do that by going to the website www.acestrategy.org. You'd also see some excerpts from these and some of those responses on our Instagram, LinkedIn pages as well, which is ACE Group. Thank you so much again. I think we will quickly just move to the next session, which is the problem solving session. We have just about 9 minutes, so I think maybe we'll just take one question. We believe very strongly at ACE that it's not just identifying problems, but also working together to plot the way forward, to plot solutions that would work, right? So quickly, let's just have one question, which is, it was discussed during the conversation. I think Dr. Leke basically mentioned a building block. So just quickly, if you were designing Nigeria's health system from scratch, right? Again, we are not, but let's just think about that. What would be the first building block you would put in place and why? We'd really just love to get your thoughts. Thank you so much, Dr. Leke, once again. Bye-bye for now. Yes, thank you so much. Okay, so first question. If you were designing Nigeria's health system from scratch tomorrow, what's the first building block you put in place and why? We'd really like to get your thoughts on the comment section to just hear what you think would be most important. I think there was a building block that he had mentioned, which Nigeria has put a lot of investment into, which is the NDH, that's the Nigeria Digital Health Architecture or design rather, which is the document, right? And then you also mentioned things around governance, the policies that need to be put in place, right? Talking about the fact that we need to align very much with national priorities. He mentioned something around interoperability. ensuring that these systems, these apps, these platforms, they're able to talk to each other, right? And of course, you talked about public-private partnerships. Very, very important that we collaborate together, we integrate together to ensure that we are solving problems together. So please quickly put in what your other thoughts are in terms of what the building blocks would look like. We're happy to have as much engagement on that as possible. We'll go straight to the next question while you are doing that, just to ensure that we're able to utilize the 7 minutes we have on the call. We really don't want to go past that time. We understand and we are grateful that you're able to take our time to attend this webinar. Really, really awesome one. Thank you so much. So the second question, please, quickly. Given where we are today, what would it take to make Nigeria's health ecosystem much more coherent and scalable? Please put your thoughts in the chat box, put your thoughts in that, but we really like to see that. If you have any other questions, please put them in the Q&A box, and then we would quickly get to it. I'm trying to scroll through now to see if you have any thoughts from anyone on the call. Please remember that we are building Nigeria together. I think there was a key thing that Dr. Leke said is, it's not just what ACE is doing. It's not just what IDOMA, for instance, is doing. It's not just what Mr. Anthony Anyanwu is doing. It's everybody. We need to work together to think about how do we build these things ourselves? How do we address these challenges ourselves, right? So it'll be really good to hear your thoughts as quickly as possible while we are collating that. In terms of the 2 questions that we had asked, I don't know, Victory, can you hear me on the call?
I can hear you, but I don't think we have any responses yet. I don't think we have any responses yet. So I guess nobody is interested in solving this problem together.
Okay, so I think I see one particular person. Thank you so much, Anwar Abubakar. So he clearly said he said something. He said the workforce strategy would be the first building block that he will put in place. And his reason, his why, is that it allows him to design strategies for talent retention and to build a bottom-up approach to critical personnel needs. I think it's a key thing. I know that Dr. Leke, like I said, he had mentioned governance, he had mentioned interoperability, and then we are thinking clearly even about the workforce, and it's very, very important that that's a building block. We'll take one person. Thank you so much for that, Anwar Abubakar. We really appreciate that contribution. We'll quickly take Dr. Abutalib Abdusalam. Please go ahead. Please bear in mind that we have just 4 minutes to the end of the course, so we really like it to be very simple and targeted. Thank you.
Yeah, sure. I'll try to keep it that way. I think that if I had a magic wand and I had to like rewind time and I had an opportunity to build Nigeria's health system, the focus has to be on physical infrastructure, but not in the sense of just physical buildings, but thinking through what are the things that you need for an efficient health health system, right? You need facilities, you need health workers, you need services, right? And you need interconnectivity between those services. So thinking about it more holistically is even when you're thinking about digital health integration, because when we talk about EPR, it didn't just start now, it's been for quite a while, right? So it's the primary health facilities, right? It's the warehouses. So we need to think about what's the distance between the health facility and the warehouse such that they can be supplied. What's the distance between medical school and the number of health facilities that you need it to service? Do you understand? So stuff like that are quite critical when you're thinking about building a health system from scratch. So it still boils down to sometimes physical infrastructure, and then with that physical infrastructure as the skeleton, you can build on other aspects of the health system into that. Thanks.
Thank you so much, Dr. Talib. That's quite interesting. So thinking about everything end to end, from healthcare workers to the services, it's very, very important. I think somebody also even included something in the comments, which was health data, right? There was a key thing about having access to data as much as possible to build on those. And they had mentioned it's basically reducing duplication, not having to repeat tests everywhere. I think our short animation even alluded to that particular challenge, actually. And I think that's something that we need to look at in terms of data being an enabler to ensure that that system is built properly. There was a response to the second question before I allow you to speak, Dr. Victory. We have just 2 more minutes. And someone said, the establishment of a general platform accessible to all Nigerians where they can input their health info. And then speaking to the fact that this data can be collected and these strategies put in place. And the person also highlighted that first is the services, and then the platform should be accessible to most of the population. I think this keys into what Dr. Talib had mentioned, where he said he's looking at the system end to end, from the services to the healthcare workers, and then to what even I think Akura Dena had mentioned in the comments, which is the data that is required. Deborah also said something around birth registration in terms of the digital infrastructure. I think if you look at it holistically, it comes from, what's the government doing? What are the policies in place? What are the enablers like data required? How are we working together? How are we talking to each other to ensure that this system is tight end to end? We have just 1 minute left. Dr. Victory, do you have anything else to add before we wrap up this session? Thank you. Dr. Victory, unfortunately, we can't hear you speaking.
Oh, can you hear me now?
Yes.
I'm sorry, I muted myself.
No
so
problem.
Sorry. Okay, I was saying that I feel under pressure. Okay, so I think what I would do first is to set the governance structure in place. I think Dr. Leke made mention of that.
He did, yeah.
He mentioned that without the governance structure in place, everything else falls apart. Because if we don't have, just like what the government is trying to do right now, set the structure, set that first platform which everybody else can plug in. And the governance structure, I mean, involves the people, right? The people in the governance, the political will, as well as the resources that we need to set things up. I feel under pressure, so I'm going to stop here now. But thank you. That was my.
Thank you very much, Dr. Victory. I think, again, very salient points from the animation to the conversation to even this short problem solving session. And I think there are 3 key things that I would say we should take back home with us. One, it's a shared problem. We all understand what the issue is, right? And we've gotten lots of solutions. One is, as you're building something, refer to the documents in terms of what Dr. Leke had mentioned, so that you're building something that can easily be plugged in. Don't just think yourself, think system-wide, right? I think another key thing is that you should know that your government is doing some work, at least in trying to ensure that these systems are put in place, right? And I think in terms of data, it's very clear that that's a major issue. And I've seen that that's a particular question that was put in the chat box. Again, like we said, we'll collect your questions, we'll get the responses, and we'll forward them either via our newsletter or our different platforms on LinkedIn, Instagram, or YouTube. But I think we should just go home knowing that we need to build together. We need to work together. We need to ensure that our systems are speaking. And when it comes to the issues around funding, we need to know that that's not where the focus should be. It's like he said, identify the problem, try to solve the problem, think about it in terms of fixing into a system as opposed to a standalone. And I'm sure that we would be able to leverage the opportunity that digital health has given us today. On behalf of ACE Strategy and Consult, or ACE Group in this case, I want to say a very big thank you to our guest speaker, even though not currently on the call, but really appreciate the time he took to be here. And also thank you to everyone that joined the call today. I am really grateful that you took the time to listen. I hope you were able to take 1 or 2 things back home with you. And I hope that we're able to build these systems together as we work. So please don't forget to fill the feedback form that Dr. Leke had mentioned. We also have a feedback form on our end, so please ensure that you're able to fill that. Another thing you should note is that our podcast would also be posted on the platform as well. Please go there. You're able to be informed on this particular webinar and other conversations that typically happen here at ACE Group. Thank you once again for joining us today, and it was a pleasure to have you on the call. Have a lovely evening. Bye-bye.
Thank you, guys. Bye.